Let's perhaps close with a question, and that's when MS has been there, and we talked a little bit spinal cord involvement in multiple sclerosis. So many patients with multiple sclerosis have spasms or spasticity. Mm-hmm. And obviously the spasticity is a presentation of an underlying injury, most likely of the spinal cord. And this can be obviously severe. Sometimes it can lead to contracture. So unfortunately, I don't think it's possible to get rid of spasticity once it's there, but it can be managed.
Yes.
So what are your approaches that you use? And I will chime in afterwards what additional approaches that you may not mention are to help individuals that have such symptoms.
So spasticity, yes, something that we really can't take away. So non-pharmacological intervention is what I start with at first. So stretching exercises, massages, are a great way to help with spasticity in the morning. In the evening, stretching is good to help with that. Another thing, then we could look at supplements, things like magnesium, which also have been shown to help spasticity over time. And sometimes just having have the patient do a course of physical therapy can teach them ways to manage spasticity when they are severe. Now, for those cases that are refractory to the non-pharmacological intervention, then go on to use muscle relaxants. And I tend to choose those ones that I know work more on the spinal cord than just working on the muscles, and they vary, and there are various types out there. And so that is how I approach it stepwise, depending on the severity, non-pharmacological, then supplements, and then prescribed therapies.
And obviously for individuals that have no or less control or some spasticity in a certain area, there are further intervention, for example, the intrathecal baclofen pump or the botulinum toxin. But I would also not forget, there is sometimes when an individual comes to me and says, you know, I have good days and I have bad days with my spasticity. It's obviously how did somebody sleep, but sometimes also just thinking of a bowel management is, for example, very important, because if somebody hasn't been able to go for several days, that's very often by the second or third day, spasticity is much more significant in such individuals. So how somebody rests and other factors may also play into all of this. And it's not just the spasticity medications that we need to use at that time.
Also, urinary tract infections can also increase that as well.
And so that's particularly true if somebody has not had a lot of them all of a sudden has had symptoms.